Imagine if the intelligence of modern day elite medical institutes existed in every hospital ward, every rural clinic, and every recovery center. The technology exists, the lives are at stake. The gap is access. More than 50% of serious adverse events occur outside the ICU. When cardiac deterioration happens on hospital floors, 40% of patients die before discharge. Globally, 1 in 10 patients is harmed by unsafe care, causing over 3 million preventable deaths. To add to that, by 2030, the world will face a shortage of 10 million healthcare workers. The issue is not medicine, it is delayed detection. In most hospitals, monitoring still relies on periodic nurse rounds, creating dangerous gaps where patients can deteriorate unnoticed. Nowhere is this more critical than in rural clinics and recovery wards, where delayed detection can mean preventable complications and avoidable loss of life. So why hasn't this been solved? Because the industry competes in the wrong place. The global patient monitoring market is already worth $52 billion, yet it is a red ocean. Companies compete on hardware complexity, ICU integration, and other quality of life issues such as screen quality. However, none of them focus on predictive explainable intelligence for underserved hospitals. We need a solution that aims to eliminate dependence on ICU infrastructure and solely manual monitoring, reduce per patient cost and infrastructure complexity, raise an early prediction window and continuous coverage across wards, and create a predictive intelligence where it has never existed before. That is where MediSense comes in. MediSense is an AI IoT powered monitoring system developed through research and engineering in IIT laboratories in consultation with practicing doctors, ensuring both technical excellence and clinical relevance. It continuously tracks heart rate, SpO2, temperature, and physiological stress, which it uses to predict 6 critical conditions early, generate explainable alerts, and run locally via edge computing, allowing it to function even in low connectivity environments. Traditional systems trigger alarms after a crisis. MediSense predicts it. That is the blue ocean we create. And we are not competing for ICU bios. We are expanding outwards. Our tier 1 non customers are tier 2 and 3 hospitals that want advanced monitoring but cannot afford ICU grade systems. Our tier 2 non customers are rural clinics that deliberately avoid complex monitoring systems due to cost, maintenance, or connectivity barriers. And finally, our tier 3 non customers are elderly care centers and recovery wards, completely overlooked by ICU focused companies. These institutions are not a part of the current market. They are a massive underserved opportunity, presenting themselves as a multi billion-dollar segment. Capturing even a small percentage creates strong, scalable revenue. MediSense is manufactured at approximately $70 per unit and priced at $199, generating strong hardware margins of nearly 65%. It operates on a recurring AI dashboard subscription model, ensuring sustainable revenue beyond device sales. Even a conservative pilot is expected to generate approximately $170,000 in first year revenue, with scalable upside as adoption grows. Now, let's talk about actual deployment. We already have a letter of interest from Balaji Hospital in Jodhpur, marking our first institutional validation and pathway to clinical deployment. From there, our expansion plan includes multi-hospital rollout across Rajasthan, deployment in post-surgical and recovery wards, integration into rural health programs, long-term expansion to elderly care facilities, and future AI licensing to hospital networks. MediSense has already received national as well as global validation. It was demonstrated at national level science exhibitions where it drew strong attention from academic and scientific communities. It was recognized at the Global STEM Best Practice Summit in Dubai, where it won the Best Innovative Idea Award and the Judges' Popular Choice Award. Additionally, the project was presented to and praised by the state government of Rajasthan through the Rising Rajasthan initiative. This proves that MediSense is not just a concept, it is an innovation with institutional momentum. In elite hospitals, predictive AI has already reduced mortality by 20%, but billions depend on hospitals that lack this intelligence. MediSense creates a new market, intelligent, explainable monitoring for underserved healthcare systems, directly aligning with SDG 3, 9, and 10. We are redefining what monitoring means for everyone, and that is our blue ocean. Thank you.